afternoon. For those of you who don't know me, I'm Nick Timmins. I'm a recovering hack and a senior associate at the Nuffield Trust, and it's my pleasure to introduce the Secretary of State to speak to us. These days, of course, Jeremy Hunt needs no introduction at all. After all, he's been in the job for almost 18 extremely eventful months now. He's appeared on plenty of public platforms. He's written the mandate for NHS England. He's been prominent in all the fallout from the Francis report. And if you're the chief executive of a hospital in this room whose A&E figures have been slipping, he's been on the phone to you. So there's no need for any introduction. So Jeremy, would you like to come and talk to us and take some questions?
Thank you very much indeed. My name is Jeremy Hunt, by the way. Thank you for the brief introduction. And you're right, it has been nearly 18 months. My job is sometimes described as the most difficult job in government. I prefer to think of it as the only job in the cabinet where there's no other MP who's jealous of my job. And I actually believe now, even more strongly than I believed when I was appointed Health Secretary, that it is and will be the biggest privilege of my life to do this job. And I have found it the most extraordinary time. And I really wanted to share with you some reasons why, contrary to what you might read in the media about the NHS after a very, very challenging year, the year of the Francis report, the year when we have had to confront some very hard truths about things that have gone wrong, I am actually very optimistic about the future of the NHS and about the future of healthcare delivery in this country. And I am more optimistic the more people I meet who work in the NHS because of the commitment that I see every day. But let me just give you three reasons, and then we can have some questions after that as to why I am optimistic about the future. And the first actually does relate to what Nick was talking about, which is the Francis report. We've had the Francis report just over a year ago. We had a debate yesterday in the House of Commons about the response to the Francis report. And I have been very humbled and incredibly moved by the response of everyone in the NHS to the Francis report. Not one person that I have spoken to in the last year has said at any stage that this is just about the problems that happened in one hospital in one part of the country. In fact, the opposite. Most people have said to me that the issues raised in Francis are issues that they've encountered in their own organisation, not on the scale of mid-staffs, but they've seen it happening here and there. And what is incredibly impressive has been the total resolve that I think everyone has shown to stamp it out and to say this has no place in our NHS. This wasn't why we joined the NHS. People who want to become healthcare assistants, doctors, nurses, managers in the NHS choose to do so for a reason which is fundamentally connected to human altruism, goodness and humanity. And everything amid staffs that we read about in Francis was a betrayal of that. And I think over the last year, we've seen some huge changes. And if I may say to the Nuffield, actually, some of them happened right here a year ago when I gave a speech on coasting hospitals. And if you'll remember, Jennifer Dixon, when she was working here, did an absolutely seminal report on the issue of whether it was possible to have a rating system for hospitals. I was very keen to do it, but I wanted someone independently to look at it because I was very keen that the new inspection regime that we introduced didn't just focus on identifying failures, but also identified successes so that the hospitals that ended up going to special measures or getting a poor rating would be able to look at the hospitals getting good or outstanding ratings and see the direction of travel and see the ladder that they needed to climb. And I think that's something that's worked very well in education, and I wanted to see if it could work well in health. And that report informed our thinking and had a really important influence on the way the CQC has reformed itself. So if we just look at what's happened in the last year, so in terms of this response to Francis, which I think is way beyond what anyone who was in this room a year ago could have predicted. First of all, the CQC itself has been transformed. It was an organisation that was in deep trouble, that didn't command universal respect, was thought to have an impossible task. And I think under the leadership of David Pryor and David Behan, and with 3 outstanding new chief inspectors, everyone, and I know there are some chief executives in this room who've had some of the CQC inspections. They've done or are doing nearly 40 trusts already in the acute sector, has seen a real change in the way that works. And I think that has been a huge, hugely impressive thing. And as a result of those inspections, we now have 14 hospitals in special measures. They were exactly the hospitals that I was talking about when I gave the speech on coasting hospitals. Hospitals that have, nearly all of them have had problems that date back 5 or 10 years and have got very, very entrenched. And here's something else that I think is incredibly encouraging. When you go to those hospitals, so I was at East Surrey Hospital this morning. Every week I go out somewhere on the NHS front line. And East Surrey Hospital is not in special measures, but they had some very profound problems 3 years ago. You may remember there was a big problem about the way they treated a patient with dementia. Something pretty appalling happened there. And you go there now, and under inspired leadership, there is an energy about that place. They are really turning it around. Basildon Hospital is another one. They are in special measures. And I remember talking to a nurse who worked there for a very long time, and I said, what is the difference now to before? And she said, it's very simple. They listen to us. When we have a problem, we speak out, and the management listen. And the chief executive there goes to the cafe in the hospital every single morning at 8:30, and any member of staff can turn up and raise any concerns they have, and she normally gets about 50 people there every day from across the whole trust, and they feel that anything they say is being listened to. And I think that is an incredibly important lesson about leadership, which we can all reflect on. So what else has happened? Big problems over safe staffing were identified. We've had 3,500 additional nurses recruited across the NHS in just the last year. We have had a big focus on safety. I don't think the NHS has ever thought harder about safety than in the last year. And I want to pay tribute to Norman Williams and David Dalton, who just completed a very important piece of work on where the statutory duty of candour should lie. And they have recommended, and this has been published today, that the statutory duty of candour should apply not just to death or severe harm, but also to moderate harm. And we are, along with changes, and I see we've got the regulators here today as well, and who are cooperating in terms of professional standards. And we will also have a professional duty of candour that will hopefully make it in the professional interests of doctors and nurses to speak out if they see something they're worried about, if there's a near miss, if they see a procedure that hasn't been followed, that will help to make us one of the most open and transparent healthcare systems in the world, very much following the example of the airline industry, which dramatically reduced their accident rate because they understood they needed to make it in the interests of pilots to report incidents rather than to cover them up. And if you think about the cockpit of a plane, that is almost the perfect place for collusion, because there's only 2 people there, and you only got to look at one other person and say, that didn't happen, did it? And they've overcome that in the airline industry with spectacular results in terms of improving their safety levels, and that's the culture we're getting in the NHS as well. So I think the reaction to Francis has been something that we can feel very proud of in the NHS, and that's my first reason for optimism. But of course, the health leaders in this room are dealing with other issues as well, and in particular, wrestling with the challenge of financial sustainability and the ageing population. So my second reason for optimism is the way that I think the service has begun to face up to some of those very difficult challenges. If I just look at the issue of financial sustainability, and I recognise there are some very real challenges here, but I think the national attitude towards reconfiguration has changed. I see that my local chief executive from the Royal Surrey is here, and I remember manning the barricades with him against some plans to close the hospital down at one stage and then at another stage get rid of the A&E when I was a newly elected MP. And there was, I think, an incredible hostility to any organisational changes. I think now, my reading of members of Parliament is that they are in a very different place. They recognise there has to be service change. And I just give you one example, which is the changes in North West London, which have gone through. They were pretty significant changes, 2 A&Es being closed, 2 A&Es being downgraded. And we don't have the unanimous support of every single MP in that area, but actually there has been pretty good support for it, and I think all but one of the local authorities was supportive. And what's the lesson I draw from that? First of all, it was a local project, and secondly, it was led by doctors. And I think both those two things reassured the public that this was going to be the right thing to do. I think the other area where I think the NHS is really beginning to face up to some big changes is to understand that our debate in the NHS over the last 3 or 4 decades has essentially been around hospital services, and in particular the challenge of how to bring down waiting times. And the last government made huge progress, and I pay tribute to them for the progress they made in bringing down waiting times, which was in 1997 the big defining issue of healthcare as far as the public were concerned. I think we now understand, in an era of an ageing population where a quarter of the population have a long-term condition, life expectancy going up by about 2 years every decade, that we have to have a fundamental, radical transformation of out-of-hospital care. And the next big piece of work we need to do to transform care for older people in this country is around out-of-hospital care. And already I think we're seeing some extraordinary innovation happening with the clinical leadership in the CCGs. But I think there is a long, long way to go. And I just sort of point out 2 very significant things that are going to happen in the next couple of months. The first is the introduction of named GPs for the over 75s. That will be, I think, a very welcome return to continuity of care. I would like to see a system where when people are discharged from hospitals, hospital doctors are able to do a handover to an accountable GP that is every bit as detailed and thorough and professional as the handover that happens inside a hospital between shifts, or when someone's moved from one part of the hospital to another part of the hospital. That is going to be a big change, and that programme and how we make that happen is part of a much broader change in general practice, which will, I think, see us move from reactive care in the community to proactive care. And I think is something that I've had excellent discussions with the Royal College of GPs, strong support from the BMA, strong support from 35,000 GPs, and I think there is a real understanding of why we need to make that change. So I think there is a realism about the need for change. And then my final reason for optimism is something that I was talking about in Manchester earlier this week, which is around technology. Because I don't believe that the NHS has really barely begun to scratch the surface of the technology revolution. And so before I came into politics, I set up and ran my own business for 14 years. So we set it up in 1992. If you cast your mind back to how we all felt about the world in 1992, and we were actually in the middle of a recession or just coming out of a recession. People were worried that Japan was going to take over the world, and no one had any idea how the internet was going to completely transform business and completely transform the way we live. And here we are in 2014, 1 in 5 Christmas presents bought online last year. We have half of us now do all our banking online. more than 2/3 of us buy air tickets online. So you've got retail, you've got travel, you've got banking that have been totally transformed by technology. Banking, incidentally, cut a third of their costs, retail banking cut a third of their costs out by essentially making us do all their work for them when we go online to move money between accounts. But that is a very profound change, which has been good for consumers and good for the industry. And in health, we haven't really started to do that. And let me just point to a few things. Now, it's very easy with technology to get carried away about how the world will look in 5 years or 10 years. But let me just give you a few things that are going to happen, not in 5 years or 10 years, but within the next 2 years, to give you an idea of why things are going to change. So electronic health records, hugely important. Everyone in this room knows how important they are in terms of continuity of care, integration agenda between health and social care. By the end of this year, a third of ambulance services will be able to access people's GP records. A third of A&E departments will be able to access GP records. And a third of 111 call centres will be able to access people's GP records, all with their consent, and making sure that we have proper security protections in place. But that will be, and then of course it will roll out beyond that third after this year. But that's a really important, profound change. Second big change is around e-booking and e-consultations. By this time next year, or at least by April next year, 95% of the country will be able to access their own medical records online, free. 95% of the country will be able to book GP appointments online. 95% of the country will be able to order repeat prescriptions online. That will be a very significant change. A third change, again within the next 2 years, is that we will see people with long-term conditions managing their long-term conditions through the use of apps. So particularly for 3.2 million diabetics, this will be an absolutely invaluable way of helping them to get in the driving seat for their own condition. And already NHS England has approved nearly 200 apps, and they're approving more as we go forward. That will be very transformational in terms of linking in an app that might be designed by a developer with a medical record that sits in your GP surgery, and the two being able to talk to each other. And we've signed a kind of single market agreement with the United States so that apps approved for use in the UK will be able to be used in the US, and apps used in the US will be able to be used in the UK, and that's to encourage developers in both countries to start developing these apps. Then there is the care.data change, and I want to pay tribute to the people who've spoken up for care.data, whether in the press or to the NHS community. That is something where the debate we've had is because we decided to do something that hasn't happened before, which is actually to explain a program that's been going on for 25 years and give people an opt-out. That's created a big debate. It's important we have that debate. But the result of that is that we will be able to carry the public with us. And I think when we've gone through this process and with the extra legal protections that we put in place, we will be able to reassure the public, and I think that will lead to huge change as well. And that's before we started talking about the scientific advances that come from sequencing genomes, all of which we are on the cusp of as well. So I think if you take all those things together, we face real challenges in the NHS. We've never had a financial crunch like we've got now. Real terms increases for 30 years, and now essentially the money has remaining at flat real, but it's not increasing anymore, but demand is still going up. So there are very, very serious challenges, real challenges to implement the Francis agenda, real challenges to tackle the challenges of an aging population. But I think what you've got is a set of foundations that we can build on. And I think with the commitment of people in this room and many, many other people, we really have got a chance of making the NHS once again the envy of the world. Thank you very much.
Jeremy, many thanks. I'm sure there'll be loads of questions. If you'd like to put your hands up and ask, I have slight trouble seeing through the lights. Just while you're gathering yourselves, just to come to the financial question, I don't know who you talk to, but I think a lot of people feel that the NHS is finally heading for a financial crisis, either just before or just after the next election. And it's been doing incredibly well so far. I mean, I think if you said in 2010 to most people in this room what would happen after 3 or 4 years of flat real, they'd say it would be in a much worse state than it is. And it's been doing, waiting times have been holding pretty well, the money's not gone crazy, and the various factors in that, not least the public sector pay freeze, which can't go on forever. But there are signs now that the pressures are building. The waiting times are under pressure and increasing numbers of NHS organisations are in deficit. I mean, what's your perception of where it is financially and what do you think needs to be done? Can it get through 14-15, let alone 15-16?
Well, look, I think there are very real challenges. I don't want to pretend for a moment that it's not more financially challenged than that's ever been before. But I think we've had those challenges for the last 3 years. I think we've had a period of where it's been very tough. But we have to embrace innovation. I mean, when I talked about the technology changes, I think that one of the things that we have underestimated is how technology can help cut costs and allow money to be spent on the front line. Things like, I was talking about it at East Surrey Hospital this morning actually, things like reducing the amount of time nurses have to spend filling out forms because you do it through an electronic pass. Those kinds of changes will make a difference. We have to continue to do that because the reason, you talked about waiting times, the reason that waiting times are actually lower than they were at the time of the last election, which is an extraordinary achievement, is because we're doing 800,000 more operations year in, year out than we were 3 years ago, which is a pretty extraordinary thing when you think the budget has basically remained flat across the system, nearly 1 million more operations. We're doing that because we have 15,000 more clinicians in the NHS than we had 3 years ago, and we can only afford those clinicians because we've had to cut away at our back office costs. A lot of the avoidable bureaucracy has been removed, and we have to continue that search. And so I don't want to suggest that's going to be easy, but I would say that it is possible, and I think that technology is perhaps the one area that we could explore much more aggressively in order to make that happen.